everyone. Welcome back. Thanks so much for your cooperation so far. I hope everyone could be able to select the language which is the most comfortable for themselves. Welcome again. Hope you enjoyed your breakout sessions so far, and I would like to thank you all for your joining those sessions and sharing your valuable inputs with us. In this part of the plenary, one of our moderators from each plenary will each breakout sessions will share the summary of the discussion that was occurred in the respective breakout rooms. Ömer and I will be facilitating this part of the session. To introduce myself briefly, my name is Erva. I am originally from Turkey and I work with the United Nations Major Group for Children and Youth as one of the global focal points for the humanitarian affairs. Ömer, would you like to introduce yourself?
Yes, thank you, Erva. Welcome back, everyone. I hope you had fruitful discussions in the breakout groups, and I can't wait to hear your reports. My name is Ömer Faruk Sönmez. I'm from Turkey. I am a youth health advocate holding executive officer role at European Dental Students Association, ETSA. Thank you. Over to you, Erva.
Thank you, Ömer. Now I just want to quickly start to listen to the summaries from each group. I would like to start with the Middle East and Northern Africa, which was held MENA session, which was held in Arabic. Zainab will be sharing the summary with us from this breakout group. Zainab is from Lebanon and works as a public health researcher. Zainab, would you like to go on?
Hi again, everyone. So in our MENA group breakout session, we discussed chapters 4 and 5. Thankfully, we had a diverse group of participants from the MENA region, which enriched the discussion. So we started with discussing some challenges to implementing ASRH services, which include lack of educational resources that are compatible with traditions of the region, and how this leads to fear and doubt among the affected communities to accept international organizations. Hence, we need to renew how we reach out to the community. And other challenges were the lack of freedom for adolescents to access sexual and reproductive health services. Parents in our regions tend to be conservative, and they consider the topic to be taboo, so it's not easy to get their permission. And then on going beyond health services, we discussed the need to integrate health services with other sectors such as education. And from our previous point, for example, teachers could influence both adolescents and teachers. So we could seek their help if we want to spread awareness about a specific topic related to adolescent SRH. We also talked about the current pandemic and how it affected adolescents, and how the lack of policies did not protect adolescents. So and then also another thing that popped up during the pandemic is that we discovered that there's a need of decentralization of services to reach everyone.
Thank you so much.
That's it from our side.
Thank you so much for this great time management as well. Now I would like to invite Amit for the other group discussion of MENA, which was held in English. Amit is from Nepal and works with the Youth Coalition for Sexual and
Hello, can you hear me?
Yes, we can.
Okay, thank you so much. We started our conversation with the ASRH issues during humanitarian crisis, and we identified inaccessible services, especially particularly health services, and safety of adolescent, family planning, and menstrual hygiene management, availability of sanitary product, increased violence against adolescent and teenage pregnancy as a highlighted issue. And the second question was, we discussed that how the participants can use the toolkit back to their own country and their own settings. We discussed that the the toolkit will help to design projects to work further in this issue, particularly for adolescent and youth, and also that the toolkit will also help to see the issue through holistic lens. And then we discussed about chapter 4, which is about priority of ASRH in emergencies. And the participant discussed about the minimum initial service package for adolescent during the humanitarian crisis situation and its component. And we also discussed how various clusters can come together to deliver the special and the unique need of adolescent during this humanitarian crisis, and how the cluster can come together to deliver full package targeting adolescent and young people. And the chapter 5 was regarding moving beyond the health services, and we discussed the importance of holistic lens, what holistic lens means, and how can why it is important to see the issue through holistic lens. We also discuss about multi-sectoral coordination, how it is important to address these intersectional issues. Thank you.
Thank you so much, Amit, for your summary. Now it's time for Pauline from the East Central Africa breakout session to summarize what they've talked about. Over to you, Pauline. Yep. Can you hear me, Pauline? Here you go. You're muted, Pauline. Can you unmute yourself? So can you unmute your, okay,
yes.
Cool.
Yes, I've been able to unmute myself. So our group discussed chapter 1 and chapter 6. So we went through the definitions of adolescence and adolescent sexual and reproductive health, and also the ASRH services and interventions. So we also went through the subgroups of adolescents that are most vulnerable, and also the definitions or the social ecological model of that presents the barriers that adolescents face in accessing sexual and reproductive health services. In chapter 6, where we talked about services and interventions, we talked about the five principles of adolescent and capacity building of SRH staff, and also the facility-based services available for adolescents. So we had a group of participants that were mainly working with adolescent mothers, and they reported that the toolkit would be instrumental in their work, and also would help them understand the diversity among the different groups of adolescents, and so they'll be able to understand how to shape their responses based on the different groups that of adolescents that are in existence. Thank you.
Thank you, Pauline. It seems like you had an interesting discussion. So it's now time for Audrey to summarize the discussion in their breakout session. Over to you, Audrey.
Thank you so much. I just realized that Pauline and I also had the same chapters, so I'll just build up a little bit on what she had already said. So from chapter 1, the key themes that we managed to source out were that this toolkit helps to inform programming in humanitarian settings. It also ensures that we meet the unique needs of the subgroups of adolescents. And also the chapter 6 highlights the 5 guiding components, as well as gives out the main key principles that are acceptable, accessible, appropriate, and that equitable as well as effective. And then in terms of the questions that we had for our participants, and they were very engaging, we asked them how organizations will use the toolkit in their organizations, and most of them said that they'll use it to influence policy changes, to open discussions with communities and understand the barriers. They also use it as a reference material, and it also lays out key definitions, principles, and approaches. It also guides civic education and awareness, and it helps to reset commitments for the Family Planning FP 2020. And also, we can adapt our programming to address the unique needs of adolescents through the meaningful participation that is currently being done in Kenya. They are currently scoping out on the best, on how best adolescents can be engaged. And this is also to be included in their country programs, which also speaks to the aspect of the toolkit being having meaningful youth participation. And the toolkit also enables the opportunity to develop strategies for programming, self-care in humanitarian settings. And the other question that we had was the challenges that adolescents are facing during the crisis. And most of them said that the lockdown restriction movements that are inhibiting them from accessing sexual and reproductive health services. Amash, I can go on and on, but I think I'll end here for now. Thank you.
Yes, thank you for being precise in terms of time. It seems like you had a fruitful discussion in the breakout session.
Yeah.
Thank you for your report. Now it's time for the 5th breakout group, which is West Central Africa, to share what they have discussed. Youth moderator Che from Advocating for Change for Adolescents from Cameroon will deliver the summary. Over to you, Che.
Thank you very much. Can everyone hear me clearly?
Yes, we can.
Okay, so we had a good discussion, a very elaborate discussion. We had to present on the chapter 6 and 8. We had quite a number of participants who joined us from Western Central Africa, the French house, and we had to look at chapter 6, which talks on community-based service and outreach platforms. We looked at multi-sectoral linkages and referral pathways. We also looked at the manager guidance notes and toolkits. We looked at the 4 main components, and we had a series of questions that came up from the participants, and I'll just highlight a few of those questions. One of the questions was how we can be able to meaningfully mobilize youth participants as parents. And we had a discussion and a response that this can be able to done from the level, because after going through the toolkit, we discovered engaging youth meaningfully starts from the level of the communities and the health organizations. So we had to make it out. We had to discuss and make out the point that this can, since we start from the community, definitely community means from the individual households and the community and the health community as well. And there was also a very, very important question, which talked on if there is any if
thank
the
you so
mobilization
much, Che, for your summary. I wish we had time for you to share more, but the recording of all groups will be made available after the launch on YouTube, so that maybe people may watch your discussions afterwards. Thank you. And the 2nd West Africa breakout group is now going to share the summary with you. Oko from African Organization from Ghana, the floor is yours. Oko, are you here in the meeting? Or anyone from the 2nd West Central Africa breakout group can share as well. Or otherwise, I will have to skip it. Yeah, over to you, Oko. We can't hear you, Oko. You have 2 devices, I guess, so try to open the voice from the other one. Maybe it fixes.
Can you hear me now?
Yeah, yes, now. Go ahead.
Okay, great. So I was in the West and Central Africa group, and straight off the bat, our participants, dynamic group of young people and professionals, they on how. So in providing some of the answers to the questions we asked, we realized that increased incidence of sexual abuse, especially for young girls, is usually on the rise during humanitarian settings. And it's usually harder to access healthcare other than in regular settings where there may be challenges, but in humanitarian settings, even to access is very difficult generally. Also, in using the toolkit in terms of to guide people's work, programming, and implementation in humanitarian settings, our participants mentioned that the toolkit and its areas, especially chapter 6 and 8, will help them begin on how to strategize to engage young girls and boys in access to family planning services, because that was their main program area. And also, it also helped them with the practical examples and case studies that the toolkit provides. It will help them, analyze different interventions and best practices in other areas to help them design their projects. Now, we also had quite a number of professionals working in programming across West and Central Africa. And one of the things that came out stronger for them is that the toolkits will help strengthen capacity of youth-led organizations that they work with across the region. And also the bit about gathering and documenting evidence for dissemination was very strong for them. Now, for the multi-sectoral linkages and referral pathways, one of our participants stated that it's really going to help them overcome some challenges because they have experienced some loops in terms of the referral pathways, because sometimes it's difficult for them to track and all of that. And so it will be able to help them overcome that. They also mentioned how to engage communities in making sure that they track and have a lot of have an integrated multi-sectoral linkages and referral pathway. Now, for our participants generally, they were very much.
Oko, thank you so much for your summary. I think we are running out of time, so sorry, we have to move to the next moderator. So thank you again. And now Maziko, who is a sexual reproductive health youth advocate from Malawi, will summarize the inputs throughout the discussion for us for the Latin America and Caribbean and South America breakout group. Over to you, Maziko.
Thanks, Oma. Also just wanted to shout out to my group. You guys were amazing. So a quick summary on what was discussed. Oh, yikes. So we had discussed chapter 3 and chapter 7 of the toolkit. And I think the first thing that was very clear was that we need to meaningfully engage young people and adolescents. So chapter 3 pretty much focused on meaningful participation. And we had asked how the participants would meaningfully engage young people, whether it's in their agencies or on an individual basis. And they say that they'll do this through circulating authentic information regarding sexual reproductive health to adolescents so that they can make informed decisions about their well-being and health. They also say that they would create safe spaces for young people to meaningfully engage and have versatile spaces that can adopt, for example, to educational institutions or homes and different kind of areas and settings. But also conducting a needs assessment so that they're able to identify different groups of young people, understanding that young people are not a monolithic group. So young people who live in hard to reach areas and young people who identify in certain groups. Another question that was asked was, how do you engage young people beyond tokenism? The key points that came out, for example, were engaging young people, ensuring that young people are engaged in all stages of the decision-making process. And we had a colleague from Ghana who had shared the pregnancy school model, which pretty much is about, if we translate it to youth participation, is pretty much about equipping young people with information, with the capacity and leadership skills so that they meaningfully engage, and that they also are aware that they can easily state and know when they're being used as tokens and how they can address that. The second chapter
Great points, Maziko. What we are, I have to interrupt, but we are running out of time. So I have to
Okay.
move to the next
Great.
summary. Thank you very much. Great points. It seems like you had great discussion. So Archimedes from IPPF Venezuela will deliver the summary in Spanish, and we'll have the English translation from Daniel. For those on Arabic friend channels, you will hear a long pause as we wait for the interpreters to relay the information. Please stay on the channel. The translation will come through, but it will take a little time. Now over to you, Archimedes.
Hola, ¿cómo están? Soy Arquímedes Reyes de Venezuela. Nuestro grupo hablamos sobre el capítulo 3, la participación significativa, y el capítulo 7, datos para la acción. Antes de discutir estos capítulos, hablamos sobre las experiencias de adolescentes en contextos humanitarios y las dificultades de acceso a servicios de salud sexual y reproductiva y las consecuencias que esto tenía. Para nosotros la participación significativa es en la que los líderes puedan liderar estos procesos y enfrentar los problemas que experimentan en los contextos que viven, no solo como simples oyentes. También deberían resolver las inquietudes, dudas y ayuda a resignificar lo que se conoce y empoderar con nuevos conocimientos y experiencias, para lo que se deberían involucrar significativamente a estos adolescentes. Hay que involucrarlos con acciones de sensibilización, los talleres y foros, herramientas para que puedan compartir con pares, uso de redes sociales e involucrar a juventudes en todas las etapas del proceso y no solo en la implementación. Hay que involucrar organizaciones, grupos y redes juveniles. Para los datos de acción, creemos que se debe realizar evaluaciones de necesidades, diseño de programa, implementación y monitoreo, y la evaluación y documentación. Estos datos también nos sirven para apoyar acciones de incidencia, compartir con grupos de pares, evidencia, también para involucrar a los adolescentes en las evaluaciones de necesidades, ya que es útil porque da más contexto y ayuda a tener más diagnóstico para el diseño de propuestas. Además, esta información es importante para no exponer o poner en riesgo a los adolescentes. Gracias.
Thank you, Archimedes. I think it's time for Daniel to translate you. Daniel, over to you, please, for the translation. Daniel, are you in the
I think
meeting?
it'll actually be Diana. Go ahead, Diana.
Diana, sorry. Diana, are you with us in the meeting?
Yes, I'm here.
Okay, we're expecting the translation from you. Thank you.
Okay, sorry. So as Archimedes was saying that the meaningful participation from adolescents, and it has to be, of course, meaningful, but they have to lead the processes and face the problems that they experiment in their context. And not just as simple listeners, they have to be resolving the questions, resolving the issues, and resignifying their knowledge and empowering with new knowledge and experiences. But the thing is that they have to came from them. It's not just from us as adults, just imposing the participation or the way that they have to participate. It has to come from them. How to involve them? We have to involve them in sensitization actions, in workshops, in forums, working with the tools from the kit, and also involving community-based organizations because they already have decision makers, so we can involve them in this process. And for the chapter 7 that we discussed in our group, We have data for action. So we need to do some assessment, evaluation, and designing of the program, implementation, monitoring, and evaluation with them. We have to involve them. We have to increase the possibility to have meetings with them, to speak with them in the same table. Those data work for incidents and communication inside of the organization and also in an external way. For example, with our local and national governments, we have to, with this data, we can share experience with the peers and evidence, and that's why we can involve adolescents in our need assessment. It gave us more context about our the field or the environment that they live, the experience that they have in the different settings. And also it can give us more data for proposals, for example. Also, we can help them to expose the risk in the different contexts. And the thing is, we encourage our team or in the group session to use the Kill tools because we have several tools in order to do checklists, for example, how to develop an assessment evaluation under ethical perspective. And I think that it was the main or the key messages that we extract from the team. Thank you.
Thank you, Diana, for the translation. Thank you all for your amazing efforts and your important inputs during the breakout groups. I enjoyed a lot moderating this session, and we'll have chance to watch the recordings of the whole program once the recordings will be made available after the launch on YouTube. Now over to Enes and Anita to close out our launch.
Hello, everyone. This is Ines. Where's Anita?
Yeah, I'm here too.
Hi, Anita. So
Hi.
I guess you're gonna start the closing.
Yes. Yeah, so we have come to the end of the toolkit launch. We thank you so much for joining us, and we hope that we have been able to provide you insight and information on how this toolkit will be useful for you and for your organization with regards to providing adolescents and sexual reproductive health information and services in humanitarian settings.
Yeah, we hope that too, and we are.
No, please go ahead.
Yeah, so yeah, we it was really so grateful and helpful to see you all guys and to hear your discussions. So that's a wrap up, let's say. Thank you, Anita, and in my turn I would like to also thank everyone for joining the launch and actively participating in the fruitful discussions we had. The amazing 18 youth moderators that joined and moderated all the event, and 11 co-facilitators who led us through the launch as well. I would like also to thank the Dutch Ministry of Foreign Affairs for providing the funds to make the revision of the toolkit possible. And of course, I would like to thank the interagency working group, ASRH sub-working group members for leading the revision process and all those who provided inputs in the revision. And of course, the star of the event, Katie, thank you. Thank you for the tremendous and outstanding efforts that you put to make this event a success. to connect all the youth moderators and to make it really happen. So today it was really great to have this event, and looking forward for the other event on the 27th. So I'll just over to you, Katie. Thank you.
Thank you so much, Anas, and thank you to all of our moderators, as they both mentioned, and our facilitators, and everyone who worked to make this such a success, including all the behind the scenes staff working with the logistics and recording and all of the work that you all put in. I just want to do a quick reminder that all of the sessions, as Omar said, are recorded and will be available on YouTube after the launch. The Arabic, French, and Spanish toolkit copies will also be available soon, and we will make announcements as they become available. And we also encourage you to stay involved in this conversation and help us roll out the toolkit in 2021. The IWAG ASRH sub-working group is open for any individual or organization to join. We have monthly calls, and we share out a lot of important information and resources through our listserv. To join, simply just email me. My email is on the bottom of the screen, and I'll also put it in the chat box. Sorry that we went over time, but it was for good reason. We had so many great conversations, and if you're planning to join the 27th, we'll see you then. Bye.